So welcome today to today's session, kind of part 2 of learning and behavior challenges. So there are going to be a couple of duplicate slides from yesterday. We do have some new folks with us today, so just going to bear with me, just kind of revisiting some of the concepts we talked about yesterday very briefly, and then we're going to push forward with some new concepts. So this is Learning and Behavioral Challenges Part 2. I'm Kristen Knight, the Professional Development Coordinator for the Schoenbaum Family Center. If you were here yesterday, you got the same spiel. This is kind of a new role for me, but previously I worked at a CCR&R doing trainings, working on CDA, and mentoring and coaching teachers in the classroom, and then I was also a classroom teacher downstairs in the infant toddler classrooms for about 13 years. This is Meredith.
Hi, my name is Meredith Schilling. I am one of the master preschool teachers here at A. Sophie Rogers School for Early Learning, and I've been here since we opened in 2007, and I feel very familiar with learning and behavior challenges after that many years of teaching, as I'm sure all of you have as well. So I look forward to sharing what I know about that and hearing from you as well.
All right, so for those of you who weren't here in yesterday's session, this is just an introduction to our building, our program. This entire building is the Schoenbaum Family Center. Within the Schoenbaum Family Center, we have a couple of different programs and entities here. So we have the Crane Center for Early Childhood Research and Policy. That's located directly behind us. Downstairs, we have A. Sophie Rogers School for Early Learning, and then we also have the Schoenbaum Family Center community programs. And we all have a collaborative effort with this. We have a similar mission to improve the well-being of young children through research, policy, and practice. So a little bit about downstairs. We have A. Sophie Rogers School for Early Learning, and down there we serve 100 children. We serve 40 infants and toddlers and 60 preschoolers, ages mixed age groups in both classrooms, 6 weeks to 3 years in our infant toddler classrooms, and 3 years until they're bound for kindergarten in our preschool classrooms. So my kind of goals or learning objectives for us today. Yesterday we spent a great deal of time talking about just development, what things are happening in a child's development that could cause behavior issues or just affect their behavior in a variety of ways. And so we talked through what some of those developmental effects were and then how we could set up some preventative measures in terms of the environment, curriculum, and kind of best practices, how to work with children in positive ways. So today, kind of moving forward, we will touch on a couple of those prevention strategies because I think it's always important to keep in mind you're always doing best practices and you're always preventing until the behavior occurs, and then you have to be more reactive. So we'll kind of revisit a few of those prevention strategies, but more about today is going to be looking at what those challenging behaviors are and how we're going to react to those challenging behaviors. So what strategies do we find are powerfully effective with really all children? But then we're also going to take a look at the teaching pyramid. And so we're going to look at those children that encompass a large group of children and most strategies work for. And then we're going to look at some of those children that those typical strategies don't always work for and where we have to do some more targeted supports, whether that's small group kind of pull-out programs and teaching very intentional skills, or if it's doing some targeted interventions. And we are going to talk specifically about what those targeted interventions are. We're going to revisit what our long-term goals are, what's important to us when we are implementing some of those discipline strategies, always tying it back to what we want for children, what our goal or our teaching goal is. We'll talk about general guidance and discipline techniques, and then we're going to move into functions of behavior. So we're going to take a look at ABC charts and different ways of collecting data. So when we have particular children that are not responding to our typical strategies, then we need to do some more observations and data collection. And so we'll look at some different ways that we've adapted ABC charts here at the school downstairs and how we found those to be helpful for data collection. And then once we have collected all that data, on the behaviors that the child is exhibiting, and we've determined what their function of behavior is. What are we going to do about it? So we've determined what their function is, and then we're going to talk about behavioral support plans. And so we have some examples of what a behavioral support plan looks like for us, how we do it. We have some things to pass out to you that I think can be really just good tools that you're welcome to take photographs of them. I tried to include a couple into the PowerPoint, just being really careful of if there's a specific child in that specific choice chart or behavior plan that we have. I was trying to be really careful about that. So hopefully you'll find some of those tools helpful for you. And then kind of to wrap it up, we wanted to talk about what are some kind of hot topics. What are those hot topic guidance and discipline challenges that you see in the classroom or in your practice? So, we always hear issues about biting in the toddler years. So what are some of the things that you're seeing with your preschoolers that you're working with, or your first graders, or your school-age children? And we'll kind of go through some of the preventative and reactive strategies that we have found really helpful for those specific behaviors. And then certainly we can kind of open it up for discussion if there is a behavior that we didn't discuss, and kind of work collaboratively and figure out some solutions. I hope this can be a good kind of forum for you to bounce ideas off of each other. And then we'll talk about how the referral process can be kind of challenging, and how we really need to partner with parents and kind of be an advocate for them and work through those referrals with them. Any questions about what we're going to cover? Excellent. Okay, so you guys saw this slide yesterday. I apologize, your handouts vary a little bit from the one that's up here. I didn't include things like the slides with the videos on there, but then I also was still doing some extra research after our discussions yesterday, and I wanted to be able to bring you some more information and some new information. So we talked about how 10 to 15% of typically developing preschool children have chronic, mild to moderate behavior problems, and that what we're hearing from our kindergarten teachers or our school-age teachers is that when those children come to school, they can't learn. And the reason why they can't learn is not because they're not academically prepared to learn, is because socially and emotionally they don't have the skills that make them successful in the classroom. So they can't get along with others. They can't work in small groups. They're disruptive, those types of things. So I kind of looked up this statistic a little bit more, and I was thinking about our classrooms downstairs, and it is a pretty accurate statistic when I think about the number of children that we have downstairs and the number of children that we have on some support plans or that we're collecting data for. In addition to that, the research that I saw this morning was also taking into account some children from socioeconomically disadvantaged areas. And what they're finding is that children from backgrounds that are socioeconomically disadvantaged, that number increases to something more like 20 to 25%. So that's huge, especially if you're working with that population. So just keep that in mind. And then the important thing too is that if you're teaching those skills, you're taking the time out of your practice to teach those social and emotional skills in your classroom, and especially for those children that are coming from some socioeconomically disadvantaged populations, we are giving them some key things to take with them, and they are acting as protective functions. So we're really giving them some important skills that are benefiting them in the long run in terms of not only academic-wise, but grade retention, being able to make it through high school, into college, those kind of things. So it's beyond just being ready for school, but academic success in general. So the evidence suggests that without these early interventions, and we're going to talk about those specific interventions for our children with those kind of behavioral challenges that are more severe, they can be predictive of academic problems, grade retention, school dropout, and antisocial behavior. So same kind of thing that we talked about yesterday. We talked about how early childhood is hard because it's unique, and we have lots of different things happening and going on. There's different developments happening with each child. We have ages, like I said, from downstairs, 6 weeks to 6 years. There's a lot happening during that time. So we talked about developmental effects. We talked about what unmet needs are happening there. So is it they've experienced a lot of rejection and not a lot of acceptance? Is it an unmet need of attention? And factors in the classroom that can contribute to challenging behaviors. So I think the other thing you need to think about is those behaviors serve some type of function for that child. And what is that function? And that's what we're going to talk about today, because you have to find out what the function is in order to find out what an appropriate intervention is going to be for that child. So when we talk about specific behaviors, we came up with some strategies that we find really helpful for biting. So even though we've listed what those strategies are that we found helpful for biting, ultimately, you still have to look at what that function is. Not every strategy is going to work, and that's the importance of having the data collection, because you're not going to stop collecting data once you've discovered what the function of that behavior is, because then you need to start collecting data about whether or not your support plan is working. So you've put your support plan in place, and then you need to keep collecting data to see, are those behaviors decreasing? They're not? Okay, then we need to make some changes and try some new interventions. Okay, so if you want to just chat with the person next to you, you can do it in a small group, whatever feels most comfortable for you. I just want to hear from you guys, chat for a few minutes, discuss what behaviors you find most challenging in your classroom or with the children that you work with right now. And I want to just kind of make a list, because we have some hot topics that we thought of, but I want to make sure we cover the ones that we didn't think of. So chat with a partner in a small group, whatever, and we'll come back together in a couple minutes. All right, so let's bring it back in, and I want to hear what your thoughts are. So what behaviors do you find the most challenging? Okay, I heard a lot of talking, so let's hear some sharing.
We talked about like a child who like always feels the need to be defiant, whether they have a choice in the matter, whether it's the hardest thing that happens all day or the easiest thing that happens all day. They just want to be in a power struggle.
And you find that's the same child consistently, or does that go across different personalities?
It's generally the one it's usually a particular child or a couple children who you feel like you're spending your day in power struggles with these children, and it's hard to get yourself out of.
Mm-hmm, mm-hmm.
Yes, Maria.
Mine is the child with the challenging behavior, more so of an attention span. Challenging behavior, like his attention span isn't there. It's more so that this child is connected to my hip the whole day. That's probably the challenging part for me.
So,
need for proximity.
Okay. Thank you, Meredith.
I think maybe in your case, you're saying probably to ensure safety for the most part, and just like a basic level of safety.
Well, I mean,
Right.
when I'm attached to the child, it's first safety, but then when I move away, the reason for the child to be attached to me is, I don't know.
It's different, yeah.
Okay.
I was
Jessica.
going to say physical aggression, specifically in preschool when you should be a little bit winking out of that more so than, of a toddler issue.
Like what kind of aggression?
Hitting, hair pulling, things of that nature.
So you're specifically saying when it's not developmentally appropriate. Yes, so that's
yes.
right. Dilshad?
Like throwing objects more so due to aggression. Physically tackling children to the floor with the chokehold.
We're getting really specific.
We have a list going on. Sitting on babies, and like just give an example for an infant toddler classroom. We have a lot of that because we have older peers and then we have our babies. So like how to keep them safe, but like more so all day versus just part of like random occurrences.
I think that can be one of the most aggravating ones because it really violates your personal space in a way that can't really be undone.
Jennifer?
Transition and self-help and inappropriate touching.
Kate?
We talked about like children that like refuse help. So like you're trying to help them take deep breaths and they're not interested. Like Jessica said, breaths are stupid. Stuff like that, where it's like very clear to you that like you're helping them through something, and it's really just that refusal to engage with you.
Right. From a teacher perspective, you're really trying to help, and you're not getting that kind of teamwork or that partnering.
Like refusal to talk about feelings and stuff like that. Where it's just like you're going up against a wall.
Right. Allison?
One that I know is like a big struggle for me is the uninstigated like emotional fallouts.
Okay.
Like constant, like where you can't really pinpoint a trigger.
Right.
Just like losing control of.
Yeah, so those outbursts. And we'll talk a little bit more about how we can start documenting that to hopefully find some kind of pattern that might not be so obvious when you're kind of in there in the thick of things with the child. Anybody else? You have anything?
Just, I don't know if this is a behavior challenge, but for me personally, it is like escaping spaces.
Running away.
Like,
I mean, running away.
exactly. I mean, not even spaces
I mean, it
controlled, more so.
It is a behavior problem because it's pretty serious. It's putting themselves in danger. I'm going to add biting because, boy, that's a tough one in the toddler classrooms.
Property destruction.
Verbal aggression.
I think that verbal aggression can be especially concerning because of how much it influences the other children in the classroom, or has a really strong potential to influence the other children in the classroom. And there's nothing you can do there's nothing immediate that you can do to stop anybody from saying something.
That's a pretty good list, for sure. And all things that we have definitely seen downstairs. And I think, too, keeping in mind, I like to think about behaviors like, obviously, we all know what prosocial behaviors are, but which one of these behaviors is like a hot spot for you? Which one really aggravates you? And it's not the same for each person. So I might consider a behavior completely unacceptable, and somebody else might consider it just borderline inappropriate. So that might be something that your co-teacher would ignore. Like, cursing is annoying, but it's not a hot spot for me. But when someone spits in my face, that's really challenging for me. And so I think it's important as a teacher to know what those personal hot spots are, because it may not be, if you're in the position where you're working with another teacher, it might not be a behavior that you can manage all the time. You may have to do a lot of switching out with your teacher, especially if you can't control some of those emotions that come behind that particular hot spot or touch point for you. So we are going to touch on things like defiance and physical aggression and biting and verbal aggression and running away and tantrums. So we'll get through a lot of those towards the end. Has everybody seen this before? Yes? Okay. So this is the teaching pyramid, and I'm just looking at it through a guidance and discipline lens. So down here we have basically your tier 1 children, and then tier 2, and then tier 3. And as the pyramid gets smaller, the number of children gets smaller as well. So most of the children that you're working with are going to fall in this tier 1 category. So the things that we talked about yesterday in terms of prevention, in terms of setting up a high quality environment, about having an integrated curriculum, a well thought out curriculum, about understanding children's development, about being responsive and having a good relationship of that mutual respect. Those are all things that we put in place for all the children, but they don't reach all of the children. That's enough for most of the children that you work for. A good guidance and discipline strategy, a great curriculum, a great environment, that is enough for most of the children, probably 80% of the children, 80-85% of the children. Then we're moving into tier 2 and tier 3 types of children. So those groups are much smaller. So tier 2 and tier 3 are gonna really encompass 15, maybe 20% of the children that you're working with. Do you want to touch on tier 2 and
Sure.
tier 3 a little bit?
And so to say that most of your guidance and discipline strategies are going to work with tier 1, children that fall into tier 1, is not to say that this is 100% effective all of the time. It means that generally for the children who are typically developing, that they are able to be responsive to that. So we know it wouldn't be accurate to say that a child who's typically developing is going to exhibit more of those prosocial behaviors 95% of the time. Sure, they're going to be defiant sometimes and things like that, but it's manageable, and it reaches this curriculum. That curriculum will reach those children. Tier 2, if you start thinking about, if you haven't already, children in your classroom, you know a few of those children. So while they're still responding somewhat, they need those additional supports. So they might need more small group work where it's more intentional. So there are many children who understand when we sing a circle time song, we come and we sit down at circle time. They understand the general expectations after some repetition. You sit down, however the teacher is wanting them to sit down and listen, raise your hand when you want to turn. But these children are hearing it, but they're not quite responding in the same way that tier 1 children are. So that might be something where you have a more intentional pull out of small group to say, here's how we do it. It has to be really explicit. I think I've said this before to some people, but these social cues are not something that just naturally comes for some children. And so we have to be explicit in our instruction. And I think a lot of us from our own education, that wasn't completely explicit. It was just expected that you knew what to do or how to act in school. And then this tier 3 are usually 1 or 2 children in your classroom where they need intensive support. So this can be behavior support plans. This could be referring a child out, getting special services to help you in the classroom. These are some of those more extreme cases that might fall under excessive physical aggression, excessive verbal aggression. And that's when, the general curriculum that we implement might not be reaching them at all. So at circle time, they might not even really know that they're supposed to be sitting down and raising their hand and things like that. This is the child who's usually not even accessing much that's going on in the large group.
So with the targeted interventions in like tier 2, as far as thinking about this from a guidance and discipline strategy, a lot of times in small group work, teachers will do something like a social and emotional curriculum in addition to the curriculum that you're doing. So they may do some small group kind of pull-outs where they're intentionally teaching social skills. I'm trying to think of the names of some of the good social emotional curriculums out there. Is Vanessa in here? Second Step, is that what we're going to be using? That's something we're going to be starting to try out downstairs. Is Vanessa in here? No. She just left. There's a really super expensive one, and I just read a study on it. I'm trying to think of what the name of it is. But those are the types of things that you're going to do for those more targeted interventions. And then that tier 3, we're going to spend a lot of time today on. Those are the ones that you're determining the functions of their behavior so that you can come up with a function-based behavior support plan.
And quite frequently, those children who you would think would fall into tier 3, they're taking up a disproportionate amount of your time than the amount of children that they actually represent, if that makes sense. So that's the child that might be on your hip. That's the child that is displaying such intense behaviors that majority of your attention and time, because of oftentimes safety reasons, your attention has to go to.
And all the while, you're always doing this. So even though you're still you're doing the behavior support plan for 1 or maybe 2 children in your classroom, the whole time you're still doing those natural tier 1 kind of preventions. So we talked about all of these yesterday, how we change the environment, the curriculum, and our expectations, and we're proactive in order to prevent undesirable behavior. So we're asking ourselves those questions like, do I have enough materials? Are there alternate activities available at circle time when 3 of the kids don't want to listen? Is circle time developmentally appropriate for this age group? And I think that's important. A big thing that's important to remember is it developmentally appropriate? So as I was listening to you guys give you your challenging behaviors, all of those behaviors are challenging. All of the behaviors are hard to deal with. But there's kind of a continuum in terms of, is it developmentally appropriate? So no matter what, biting is hard. It's always going to be hard. But biting for an 18-month-old is developmentally appropriate. When it's happening at 5 years old, it's harder to understand and harder to manage. Same with frequency. So if a bite happens once every couple of weeks, not as difficult, still difficult, but not as difficult if it's happening multiple times a day to the same child. It's very, very hard to send a child home to their parents with 3 bites in one day. That is very difficult. So thinking about like duration and intensity and whether or not that behavior is developmentally appropriate. So same with like physical aggression. Having a child who hits other children to get a toy is very different than having like a table thrown at you. So thinking about kind of the intensity of those behaviors when you're thinking about whether or not a behavioral support plan is necessary. Proximity, we talked about that, limiting the number of transitions and having those environments set up in a way that promote independence. So we're giving them power and we're giving them control. So always going back to this, even with your behavioral support plans, these are always going to be our goals. So we always want children to feel good about themselves. We always want them to eventually get to a place where they're guiding their own behavior and they're disciplining themselves. So I don't want it to come off as if we are kind of giving opposing ideas, because we talked about children being intrinsically motivated and learning how to regulate their own behaviors. When we get into the place where we're talking about functions of behaviors and doing behavioral support plans, it is a little bit more on the behaviorist type of scale. So you are putting these targeted interventions in place that appear to have some type of extrinsic motivation there. So ultimately our goal is still intrinsic motivation. We want children to guide their own behavior because they want to, because it comes from within. But some children do need some of those external types of controls. But we always want to learn how are we going to fade this out, and so we don't have to use something like this all the time. How are we going to phase that out so they can internally regulate those emotions and they can get through the day without the need of something extrinsic?
And that really speaks to the importance of individualization, knowing that one blanket strategy is not going to work for all children. Thinking about that teaching pyramid, thinking about the different ways to individualize, and even still individualizing for those tier 1 children, it's just so important to know the child, make those observations, and then be responsive in terms of your practice.
Okay, so again, kind of get together with the people you were chatting with before. I want you to think about the tier 1 support. So think about the things that you put in place all the time in your classroom in terms of guidance and discipline strategies to deal with those types of challenging behaviors. So it doesn't have to be a behavior that's super intense, but it is somebody who spits or maybe throws the trash can or has those tantrums in your classroom. How do you react to that? What types of strategies do you use? And then do you find the most effective with most of the children in your classroom? And do they meet those long-term goals? All right, so let's hear what you came up with or what you find to be pretty effective in your classroom setting for dealing with some of those challenging behaviors.
We talked about just ignoring some of the behaviors that if you've identified that it's just attention seeking, that and knocking something off of a shelf, or if a child's like yelling at you, and you know that it's just about that reaction, just refusing to give it, and then really amping up your conversations with other children, promoting some of those pro-social behaviors you're seeing around. If this child isn't harming anyone, isn't harming themselves, ignoring and building up everything else.
Okay. So we'll talk about planned ignoring as one of our strategies. What else? Come on, I know you guys do other things.
Giving an appropriate space to perform the action. So like for spitting, like going to the bathroom, like you can spit when you brush your teeth. Or if they're throwing something, giving them a ball, which is an appropriate thing to throw versus like a block at someone's hip.
Okay. So if giving them an appropriate space to do those, or redirecting them to an appropriate place to do those types of things. So it's not a choice to hit your friends, but you can hit a pillow. You can, you know, you're not allowed to spit in the classroom, but you can go spit in the toilet or in the trash can. Those kind of things. Great.
This maybe isn't preventative for the children, but for us, we talked about the breathing. Like even when you're starting to get frustrated, we've been teaching the breathing to the children where you take 3 deep breaths. And then giving messages.
Some calming techniques. You were going to say something?
Yeah, we talked about being explicit and intentional with language and giving them those words, because we say them all day long, and a lot of the kids pick up on them when they're hearing us say them all day long, but some of those kids need the intentional, these are the words that you need to be saying in this time, and then they start to expand on those after that. But sometimes they're just, like you said, they don't come with those cues, or they don't come understand those cues, and sometimes they're not picking up on them, so being very intentional on making sure you're giving them to them.
Yep. And it's kind of become a really classic phrase in early childhood to say, just use your words. But we forget that sometimes they don't have them. And so you need to go one step further. It's true, use your words. That's a very true statement. It's a statement that we should continue to say. But whether they have the words or not, sometimes they need a reminder of what those words are, because whether they're heated in that debate of conflict or they have a language delay, use your words. Tell him, stop, I don't like that. You took my toy. You know, you need to go one step further and be really explicit about those language cues.
We were just talking about kind of in the bigger picture that when you're in a center where you have multiple classes, that you have some flexibility in moving children between classes. Like if a child's been in your classroom for 2 years, and maybe there's a dynamic of kids or the dynamic between the teacher and the child, maybe, you know, that's not the best. Maybe we shouldn't do a 3rd year, you know, with that group or with that teacher, that having some flexibility to let the child have a fresh start in a new classroom with a new teacher, that hopefully that would, you know, prevent some of those things that we've been seeing in the past. Maybe that's just not a good dynamic. So kind of looking at the bigger picture, when you're making your classes for each year, like who's in what class, and who is this little guy, who's he tangling with all the time, who's he having power struggles, maybe that's just not a good dynamic. I mean, you still have to work it out, but don't set it up so that you're having a year like that.
Yeah, I think you can definitely be intentional about like your transitions. If you are transitioning, we don't transition very often here, just one time between infant toddler rooms. But if you are transitioning, you know, every 6 months or every year to a new classroom, being really intentional about how you group children, and if you think they're going to have a good fit in terms of temperament. I know oftentimes we'll say, you know, sometimes it doesn't work out, but I think this particular child would have a really good dynamic with this teacher. I think they would have a good temperament interaction between the two of them. So we often say those kind of things. You know, the only side note I would say is, you know, keeping continuity of care as much as you can in terms of, you know, not that being the sole basis for like transitioning a child out of a classroom, being that it would be behavior problems, because we don't want to set up the message that when you behave in a certain way, then this is going to happen.
It just kind of like in Dublin, in our preschools, there's only one preschool classroom, maybe in an elementary school, sometimes 2. We used to be all together, but now we're all separated. So we used to have the flexibility to, you know, if someone's had 2 rough years with a child, we might give them a fresh start somewhere else. We really don't have that opportunity anymore, and so, you know, there are years that kids are having the same issues year after year, and it just might not be a good dynamic, you know, so do we initiate with our supervisor, hey, maybe this child needs a change, or do we just keep plugging away at a behavior plan, or, you know, what's best for the child is what we we try to do, but
Yeah, and
we
I
don't
think
always have control over that.
I think really taking a look, like if you are doing like ABC charts and documentation, and that way finding out what the functions of that child's behavior are, because if it is linked to a particular teacher or a particular, child, group dynamic between, two trigger children or something like that, then you could have documentation proving all of that stuff. Do you know what I mean? If you're doing those ABC charts and you're seeing the same thing constantly, that it's an interaction between teacher A and this child every time, or interaction between this child and another child every time that a behavior escalates, I think that's good documentation to have to inform practice or decision making.
Here, do you, like kids that come in like as infants and then toddlers, do they stay with like the same group of kids every year?
Yeah, so our infant toddler rooms are mixed age, so when they come in, they don't transition out of that classroom until they turn 3 and go to preschool. Yeah, so there are some kiddos that we have from 6 weeks until they're 3 3.5 when they transition to preschool, and then some kids come in are enrolled at 2, and we only have them for a year. It just kind of depends on their enrollment date.
And we're a year-round school, so there's not that break that I'm assuming you have in the summertime, so there's not that kind of reassignment or.
Is it in our preschool classrooms, especially if there's only one in that building, they come in at 3 and they stay until they go to kindergarten. So they have that same teacher maybe for 3 years.
Yeah.
It's depending on that birth date where
Yeah.
that lies.
Yeah.
Jen?
What works for us is like switching out. Where not even just switching out in that classroom, like she said, maybe having that teacher come into that classroom to kind of give not just you a relief from that child, but the other children as well. And planning ahead or having the brief conversations and throughout the day, like, hey, I noticed such and such was tired, or, they didn't eat that much for breakfast or for lunch. So, we're kind of planning to be ready for, hey, he's going to run, someone's going to scream for 45 minutes, like something like that. So just having the brief conversations with your teaching team is always very helpful for my class.
So knowing what some potential triggers might be, what some setting events for some of those behaviors could be. Great.
Just the general, I think we forget just because of the way we are as teachers, just those really basic, like teaching how to share, being explicit about it's not okay to just take something without asking, here's how we do it. Those are those skills and those lessons that are going to really reach children who fall in that tier 1, that they might not know that initially coming in, but after some repetition and exposure, they're going to be able to do that. Those things that we just see as basic ways that we run a classroom.
So these are all pretty obvious and explicit in and of themselves too, but just good practice. So how your body language and the way you convey a discipline strategy or a guidance strategy to children is really important. So if you are across the room and you notice somebody's running swinging towards somebody else, yelling from across the room is not going to be effective for that child, because the only message that you've really sent at that point is, one, if it's an attention-seeking behavior, boy, you played into that because you were loud and proud back there. And two, if you're showing them another challenging behavior. So go ahead and be screaming at everybody. It's a powerfully effective modeling technique if you're screaming from across the room to give them a message. So being down on their level, making eye contact, being really explicit about what you're saying, being specific in your explanation. Here's the behavior that's unacceptable. Here's why it's unacceptable. It's okay to be firm with children, and when I say firm, you can still be very calm and have a neutral tone of voice, but also be very serious when you're saying that. The tone of your voice should be calm and neutral, but your face should match what you're feeling too. So stop. It's not okay for you to do this. Very, very explicit and firm. And then you can state and model what the appropriate behavior is. So not just saying this isn't a choice or this is not okay or this hurts. Here's what you can do. So if you're going with a redirection strategy like Krista was saying, you can spit in the toilet, you can spit in the trash can, giving them a way to fulfill that behavior. Always validating their feelings, or also validating the child that's been hurt if there are two children involved. So not just making over the child who just, got swatted at or their hair pulled, but then also validating the child who did the aggressive behavior or the challenging behavior. I can see you were really frustrated and you wanted that toy, but it's not okay for you to hit somebody or pull their hair. And then we talked about this yesterday too, about giving them a safe, cool place to cool down, and that's not the same as timeout. But all of our classrooms, we've always been really intentional about having like cozy spaces in our infant toddler classrooms, because those environments are very specific to infants and toddlers and it's necessary. But over the years, as we have been around a lot more challenging behaviors in our preschool classrooms, they all now have kind of a calm down space, and that's something that we've really worked hard on, trying to make those spaces really explicit about. So this is a space where your body is calm. Here might be some pictures of different emotions, some feeling books, it's got pillows, those kind of things, to really bring down some of that stimulation that's happening and having a place, for calming and reflecting.
I really want to emphasize what Kristen touched on with the volume and tone that you have. It's much more effective if you're always kind of, on a scale of 1 to 10, if your volume and your tone is always right around a 5, 6, or 7, it's not going to be very effective if you're always at that kind of heightened level. But if you are generally in a calm state and have a calm tone and volume, or like a 1, 2, or 3 if they're on that scale, it's going to be much more effective when you see a child running out of a classroom and you say stop, and they really hear that tone in you and that volume, that's something that they haven't heard before. It really communicates more than just what the words communicate. It communicates the seriousness of the situation.
And then your facial expressions.
Absolutely.
Too. I know I always tell Meredith is one of my my oldest daughter's teachers, and she will absolutely, I can tell that they do a lot of recognition of what faces mean and matching that to emotions, because when I get really frustrated at home, she'll say, "Mommy, what's your face saying?" And I'll say, "It's frustrated because I've asked you to do this 3 times and you're not listening to my body, and now I'm frustrated." So she's definitely in the camp where she's matching what your face is saying and what your tone of voice is saying and what your message is saying. So obviously with these tier 1 kind of practices, we're giving children positive directions. It's really, really hard to hear don't and no thank you all day. And we've talked about this lots and lots of times, because boy, that's a touch point for me. When people say no thank you to children, it's just a polite way of saying no. Mm-hmm. So if you're in the camp of saying no, then that's fine if that's your strategy. But it's the same thing. So I'm more of the person who says, let's direct the child to what they can do instead of what they can't do. It'd be really hard for us as adults if your supervisor was telling you, every idea that you had, you couldn't implement it, or no, they didn't like that idea. It'd be really hard to hear as an adult, to hear no all day. And the same thing's true for children. So let's try and tell them yes, or what they can do. That doesn't mean you have to change your limit, but you can tell them what they can do instead of what they shouldn't do. And then with the expectation that with these age of children, repetition of directions is developmentally expected. So we're going to have to tell them, and we multiple times, and Emily touched on that yesterday, that even though, boy, you want to say, I've told you 6 times that it wasn't a choice to scale the walls, they still need it. They need it 6 times. They may need it 10 times. It depends on the child. It depends on the context. It depends on the environment.
And to them, it doesn't matter that you said it 6 times. It matters to you. So you saying that, to me, that always signifies to me, if I'm at that point where I said, I've told you so many times, that's my frustration. I might as well turn that around and say, I feel frustrated when. That really puts it back on me and my emotions, rather than expecting a 3, 4, or 5-year-old to interpret what that means when I say I've said it 6 times.
So we touched on conflict negotiation and resolution yesterday towards the end, and it felt a little rushed. So I wanted to make sure that we just kind of briefly talked about that again in terms of how important it is to give children choices throughout their day, allowing them to make decisions about things that happen in the classroom. And I think what that tells children, when you are allowing them to offer solutions, whether it is about sharing a toy or making a plan or something like that, when you get down and really talk to children and ask them to come up with solutions, you're communicating something really powerful to them. And that is that you trust that they can fix things or attempt to fix things, and you trust that they have good ideas. So I think it's important for us to hear what they're thinking and what theories or hypotheses they've come up with in terms of fixing a power struggle between them and another child, or if they want a toy that's not available or something like that. So offering them, the ability to make choices and decisions. With that, keeping in mind, though, those choices have to be ones that you can live with. So they don't have to choose about every aspect of their day, but they need to be really real choices. So you can't say to them, it's time to go outside and you need to put your shoes on, or you need to get your coat or something like that, and they say, no, I don't want to. You can't say, well, then you're going to have to stay inside. If you don't physically have a person that can stay inside with them, it's not a real choice for them. So you might really want them to have to stay inside because now you're in the struggle and you're winning that battle. But it's important that choice is real, because you've just made a bigger problem if you say that and then you can't follow through with it.
One thing on this, I thought of an example as you were saying this, Kristen. Something also to consider as a teacher. We want to fix and we want to help, and that's probably why we're all in this profession to some degree. But really making sure you're not making assumptions about what the problem, what the conflict is, especially between two children or a group of children. The example that comes to mind, and I think I went and used the restroom, or I was coming back from a meeting. Something happened where I came into the classroom and I said this and I directed a child this way, and then I came to find out the root of the conflict was not at all what I had made an assumption of. Therefore, my response to it didn't match it. And I really it was a humbling moment where I said, wow, you just came in and you just took over and you tried to own the conflict and resolve it, which was not meaningful at all to the children, because the conflict wasn't what I thought it was, but it also wasn't meaningful because I didn't give them the trust. In thinking back, I could have come in and I said, it looks like, and I could have described what I saw and then allowed them to the conflict to come up through their words and their actions. Now we'll talk about planned ignoring, which Jennifer, you're speaking of, I believe, right? And Emily. So planned ignoring doesn't mean that you're ignoring the child completely, right? You're attending to their needs, you're assessing the situation. This is effective oftentimes with children who are in that tier 1 or tier 2 category. So their behaviors might be a trigger point for you. They might be annoying. They might be kind of loud. A child who just screams to try to get attention, if you give that attention, that is very powerful. That reinforces every time I scream, that teacher's going to drop everything they're doing and come to me. Now, as adults, we think, well, why would they want negative attention? Most of us have heard that any attention is good attention, especially in early childhood. So it doesn't matter. It doesn't matter if you come over and you're frustrated and you're angry. They got your attention. And oftentimes, it's already been reinforced in another setting or in your setting. What you have to be prepared for in terms of planned ignoring, you want to be physically in a place that you can ensure safety. So if you know this child well enough and know that maybe ignoring them when they scream often escalates to then they pick up a block and they throw it at another child. That's a big trigger for me, and I think would be for most people. When I feel like I can't protect the other children in the classroom because one child's escalating behaviors, I have a hard time managing my own reactions to that. So also, it's used for inappropriate behaviors. Again, think about what's happening. Are they harming themselves or others? That's something you really can't ignore. Destruction of property, I think, can go a few different ways. It depends. Is it a destruction of property ending in harming another child or themselves? If a child is ripping up paper or ripping up a book, as long as I know they're not ripping up 50 books, even though we want to promote literacy and encourage, careful work. Yes, exactly. If ripping up a page is them destroying property, and if I ignore it, then they stop, then it's okay. I can tape that together. We can look for more funding for different books, things like that. The reason this works so well with Tier 1 and Tier 2 children is because oftentimes they haven't had those strong reinforcements, so meaning strong reinforcements that they get what they want based on these challenging behaviors. So oftentimes this child really, really wants you. They love you as your teacher. They want you to impress you. So if you are throwing a tantrum and it's not harming them and it's not harming another child, if I ignore that and I start pointing out that, oh, Olivia, I like the way that you're sitting and you're playing with those blocks. Oh, Jeremy, I like the way that you are sharing with your friend, pointing out those behaviors. The child who often falls in Tier 1 or Tier 2 is looking around like, what can I do to make this teacher happy? Because they do love you and they do respect you. And they realize through that wasn't effective. I didn't get what I wanted out of that. But it takes a lot of patience as a teacher, and it takes a lot of discipline, and it takes some teamwork too with your co-teachers. So that can sometimes happen if you are using this strategy of planned ignoring, and this happens often with families or somebody who just doesn't maybe understand the dynamics of your classroom. They come in and they say, what's happening? And you think, there it goes. It just reinforced that behavior. They got the attention that they wanted. And again, oftentimes this is falling into attention-seeking behavior or escape.
Yeah, I know we've had that escalate too, where it's like, oh, it's just a tantrum, so we're going to ignore that, and had a great plan, and then it turned into some self-injurious behaviors, and then at that point we had to then step in because obviously we weren't going to let the child harm themselves.
Thinking about redirection, something we really want to emphasize is redirection is not distraction. So redirection is helping a child by guiding them into a more appropriate behavior, but that behavior should be equal, satisfying, and similar to the challenge behavior that they're exhibiting. So say you're a teacher and you're reading a lovely book to a group of children, and another child comes up and starts banging, say anything, a block on the table. It's very distracting. Rather than saying, put the block down, come sit with us and listen to this book, you could say, it looks like you want to bang something. Here's a drum that you can bang. It's much more satisfying, and it's really showing respect for the child, that you're not just telling them that's inappropriate. I know it's appropriate as the person holding all of the knowledge. No, it's saying this is what you need. I think about that as you have to think about in your preschool classroom and your infant and toddler classroom that while we try to give a lot of respect and space and independence for children, they really are bound to the limits of the physical limits that we give them, and then the behaviors that are acceptable within that. So us as adults, we could say, you know what, I need to go take a walk because I'm feeling really frustrated right now. I'm going to go, you tell your co-teacher, I'm going to leave, I'm going to go take a walk. You've just satisfied what you needed, but those children don't necessarily have, they don't usually have the coping mechanisms and the ability to tell you, but they don't have the freedom. So really respecting that might be something developmentally, emotionally that they need right there at that moment.
Okay, so moving on to limits. Basically, how we kind of think of natural and logical consequences in terms of limits is kind of the last straw we take so at that point we've tried preventing it, we've tried changing our environment, we've redirected, we've tried some conflict resolution, all those other things that we talked about, and now we're going to set limits because they weren't effective. So we break those limits down into two types, natural consequences and logical consequences. With natural consequences, basically the definition of a natural consequence is the child experiences the direct result of his or her behavior. So the teacher's not really doing anything. It just naturally comes as a result of the behavior. So a great example of that would be a teacher might say, it's not a choice to be running in the classroom because the sensory table had spilled or something on the floor. There's water on the floor, and the child chooses to run anyways, and then they slip and fall. That is a direct result of that child's behavior. Now, granted, that you're probably not going to do that because you would have already wiped up the spill, and that's why I put on there too often. We deprive them of their chance to experience natural consequences, but often in the classroom, we deprive them of that chance because it's a safety concern. So natural consequences can be much more effective for parents than they are for teachers in the classroom. So I've had lots of times when a child doesn't want to put their coat on and it's, the polar vortex outside and their parents are like, meh, it's a short walk to the car. They'll just be cold. Obviously, as teachers, we can't do that. That's directly putting a child in harm. But a parent can say it's literally 2 seconds to get into the car. But I'm going to let them experience that. And I've had parents say, yeah, boy, we didn't even make it 3 steps before he put his coat on when we were on our way out to the car. So that's what a natural consequence is. What we use more often in the classroom is a logical consequence. So these are consequences that are imposed by us, but are still directly related to the behavior. So those can kind of be broken down into a couple of different types. This was just happened to be this photograph. We had a little power struggle about putting shoes on to go outside. And so that led to a tantrum. And so the logical consequence that I imposed there was it wasn't a choice to go outside until you put your shoes on. And I sat there with her, and she was fighting the good fight because she fell asleep before putting her shoes on. So they are useful when natural consequences don't work or when there's a situation when it would be unacceptable because of a safety issue. The 3 types are exclusion, deprivation, and restitution. So with exclusion, what that is, in this instance, maybe the child's harming another child. So you're saying to that child, it's not a choice for you to be near Tommy until your behavior changes. So it's not a choice for you two to be near each other because you're hurting him. So you're excluding the child from another child that he or she is harming. With deprivation, that's kind of like exclusion, except for it has to do with materials. So you're not being safe with a certain material, or I'm going to deprive you of a certain material because you're misusing those materials. So something like that might look like you've given multiple messages about throwing the sand out of the sensory table. That has happened several times. You've given 3 or 4 messages. The child is still continuing to throw the sand out of the sensory table, so you might set the limit as it's not a choice to throw the sand out of the sensory table. I've given you that message several times, so now I'm going to help you make another choice in the classroom. Always letting that child come back to that choice at some point in the day, but it might be you're all done with that idea for the rest of the morning, and you can try again in the afternoon. Then the last one is restitution. So restitution basically is what you think of when you think of like prison restitution. So you're making up for a particular act, or you're making a child feel better. So it might be assisting an injured person, it might be cleaning up something that you've made a mess of, or rebuilding a structure. So you're basically fixing, paying for, or making a child feel better because of your behavior. So we've kind of touched on these. So when you are setting those limits, or you are implementing pieces of your behavior plan, what we're going to talk about next, it needs to be immediate. So it needs to happen right then. I mean, it's just like when you are doing things with what my dog is currently enjoying, peeing on the carpet. And so I keep explaining to my husband, like she doesn't get it. Like it happened at some point when we're gone, so disciplining the dog now isn't helpful. Same kind of thing for people in general. Like you need to link that behavior to that consequence immediately rather than in 5 hours. It's over at that point and they don't remember it. The limit or consequence must relate to the behavior and it needs to be meaningful. So those redirections need to be similar and equally satisfying, and the limits need to always relate back to the behavior. There has to be some kind of connection. And then finally, allow children to show you that they've learned from the experience. So ultimately, that's our goal when we're talking about those long-term goals, is we want them to learn from their behaviors and make changes and be able to make decisions independently about them. So we always have to let them try again. So if you're excluding them or depriving them of some type of material in the classroom, it's not forever. It may be for an hour. It may be for 10 minutes. It may be until you've calmed your body over cleaning up the sand for the 15th time. Okay, so the big question is, so which behaviors require additional support? So how do we know when you need to take it a step further and those guidance and discipline strategies that you are already implementing in your classroom aren't enough? and you need to do some more targeted supports. So you've done all the right things, you have a great environment, a curriculum, and some great strategies in your classroom for guidance and discipline, but you're not reaching all of your children. So we need to figure out which behaviors require some additional supports. And that's the big question, and the perfect answer for that is, it depends. So there really isn't a clear answer for that. You have to make that decision based on a lot of different factors. So some things that I think about is that individual child. So think about the behaviors that they're displaying and think about their frequency, their duration, and their intensity. So I've had children where I'm like, the behaviors itself aren't all that bad, but that's all I'm doing all day is the same behavior, and it's just cyclical, one after another. So it starts with this message, and then that turns into hitting, himself, and then that we've calmed him down from that, and now he's hitting somebody else. And so they're not technically developmentally inappropriate behaviors, but the frequency of them it's just all day long, and so he's not getting anything out of the day. So you have to think about those types of things within that unique child: the frequency, the duration, and the intensity of those behaviors. The other thing I think you can think about is the adults. So is mom or dad or grandma or whoever is the primary caregiver for that child reporting to you about those specific behaviors and how they feel about those behaviors? So I think I don't have control of these behaviors, it's getting to be too much, we need to do some more targeted interventions. Or are teachers in the classroom ranking it that way? So have you as a teaching team talked and said, this particular child, I don't feel in control of this situation, and I've tried all these different things and I'm feeling burnout? Are multiple people saying those kind of things? And that might be a good indicator that that child might need some more behavioral supports. Similarly, I think you can look at the environment and you can say, have I done everything that I can do in terms of those preventative strategies? And then if it's a particular behavior, are other children behaving in the same way? Because if it's more than one child or more than two, maybe 2 or 3 children, you see multiple children behaving in a certain way, that's probably a good cue that it is something that you might be able to do preventatively. So it may be something with your curriculum and your environment if multiple children are responding in the same way to a certain piece of your environment or certain routine in your day, something like that. And then also I think you can look at those specific behavior examples. So looking back, is it developmentally appropriate? But it could be things like, is it dangerous? Is it dangerous to other children? Is it dangerous to that particular child? Is it destructive? Is it disgusting? Is it something like spitting? Or we've had many children in our experiences say things like, "I'm going to pee on myself," or I'm going to pee on the floor," or something like that. So those are probably not appropriate behaviors, and they may need some type of behavioral support plan. And again, is it developmentally inappropriate? So obviously something like that is very intentional if a 5-year-old is saying that. We would obviously, if it's unintentional, we would expect like a 2-year-old to have accidents. But a 5-year-old who's potty trained is very intentionally saying something like that, or intentionally making something destructive in the classroom, breaking materials, more than just, like Meredith said, a book, but intentionally kind of throwing furniture, dumping, shelves over and breaking the materials in the classroom. Those could be good indicators that maybe a behavioral support plan needs to take place. Meredith?
So has anybody heard of this, the ABC contingency? We've alluded to it. Okay, so it sounds like everyone's very familiar. So earlier Jennifer was saying something like when communicating between teachers about a child maybe not sleeping very well, or communicating with a parent, they didn't sleep well last night, or we know that they didn't have breakfast. That wouldn't be an antecedent, that would be a setting event. What an antecedent would be is that kind of trigger. What is the condition that influences that behavior? So in that case, the setting event might be that the child didn't sleep very well. The antecedent might be a child took another child's toy. The behavior that we see as a result of that antecedent is that child A hits child B. Then the consequence is, of course, the outcome. What is the result? So that might be that the other child gets hit. That might be, like hit back is what I mean. It might be that the teacher intervenes and that teacher then uses exclusion to say this has happened so many times. So that the reason why we want to follow this ABC and chart these things is so we're not going back and saying these behaviors keep occurring and we just keep butting heads. What can we do about it? There's nothing productive about saying, oh, that child does that every single day. You're frustrated. It's not helpful to the child. It's not helpful to the classroom dynamic. Let's figure out what we can do from here. So this is what that looks like, just like I said. So again, setting event could be lots of different things. Setting event could be a child witnessing a argument between their parents. A lot of things we think about more in those hierarchy of needs, though, when it comes to children, the sleeping, the eating, things like that. Do you have other examples of it, of setting event?
Those are typically what we hear, like with our kind of behavior kiddos, as that mom or dad will come in and give you that morning message, like, he had a really hard evening last night, or he was up all night because of the storms, you know, those kind of things. And those are good things for us to keep in mind. This is probably going to take a turn for the worse throughout the day.
And instead of just, you know, you don't say, well, he's just going to have a rough day, maybe using some more of those preventative strategies, maybe closer teacher proximity to that child. So when there is a conflict, you can be there to help negotiate. So you want to be proactive, but when we feel like we've implemented a lot of those preventative strategies and they still haven't been effective, it's our jobs to document and say, maybe there's patterns that we're not recognizing. Sometimes it's also helpful to bring in an administrator or another teacher from another classroom to say, can you come observe what's happening? I can't seem to figure it out. And just having a different set of eyes on it sometimes helps.
So here's just an example of an ABC chart. I also included one with your kind of packet of information. And this is probably the one we use the most. Can I hold that up? That we use the most initially when we've kind of identified a child that needs some documentation to happen. It's very detailed and open-ended, so it's requiring a lot of documentation on this particular one that I handed you guys out. And that's usually where we start, with something very open that requires a lot of writing on the teacher's part. I think the other thing that's important about that is that everybody needs to be on board in the classroom. So if you're taking documentation, I don't think it works if only one teacher is taking documentation. When you leave the classroom or you're not there, the other teachers need to be on board and be able to document as well. It's not effective if you're not documenting everything. Almost every time needs to be written down if at all possible.
And that could be really tedious, and you could think about a challenging behavior you've experienced in the classroom, and you're thinking, I'm so busy addressing the behavior, but what else is tedious is coming in every single day and saying, this is going to happen. You know, we have to be proactive and say, there's got to be a different way to approach this.
Yeah, and it can be frustrating from a teacher perspective. I remember like having one child that was particularly hard and doing the documentation for him, and as I was documenting, more injuries were happening during the documentation. So I was feeling really overwhelmed with trying to write everything down and be really detailed, because in the 2 minutes that took, a child was bit and another child like just got beat over the head with a block. So that was really frustrating, but in the end, like after the documentation, the detailed documentation was done and we could do something more quick and productive, then it was worth it.
So what's important from once we look at that ABC data, and sometimes it takes days and sometimes it can even take weeks to collect enough data where you really feel like you can determine what the function is. There's also something called the functional behavior analysis that can be helpful as a little survey just to take and say, oh, it categorizes, here's one going around, what the function of the behavior is. Again, oftentimes we see attention seeking as attention, as a function of the behavior, or escape. And that doesn't mean necessarily escape like I physically am leaving this space, but it could be escape as though every time I throw a tantrum, I don't have to sit down at circle time. The teacher always takes me and I have to go somewhere else. Maybe the function is that, the reason is that the circle time is not developmentally appropriate for that child. And so, boy, that sure is reinforcing. Every time I tantrum, I get to leave. So really looking at that can help you understand how to address the behavior.
And I think with finding the functions of behavior and the part of why we do an ABC chart is, as teachers, we are all about documenting and observing. We know how to do it, we know how to do it well. But I feel like what we do really well is the A and the B. And we forget about the C sometimes because we're thinking what the trigger is the A. So what happened before or where it happened. So it's always happening in the sensory table or it's always happening between these two children. But what we forget about is the C. And the consequence is often where the function comes in. So how that teacher is reacting or how that child is reacting. So it's important to look at the patterns across all three of those things to see if it's multiple behaviors, multiple antecedents, which is usually a different antecedent sometimes any time, and then what that constant consequence is.
So imagine if you are collecting this data and the consequence always is teacher proximity, ends up like a teacher addresses this. That antecedent might be the child hit another child, the child threw food, the child refused to do something. Every time, no matter what the antecedent or the problem behavior was, the consequence ends up being that they get direct teacher attention. That's what your function is. And like I had mentioned earlier, and it's going around the functional behavior analysis, again, it's just systematic. It's important to do this so you're not just going on your hunch. Certainly you have hunches, but when you really look at it and you break it down, there's four different functions of behavior. So attention maintained, what I was just addressing, escape or avoidance. So that example about circle time, access to tangibles. So this can be something, can you have a good example of access to tangibles that you can think of?
A lot of the FBA videos that I've seen, like between parents and children, would be like the child wants pop or a sucker, and she throws a tantrum because she wants that. Mom gives in, and then she gets the sucker, and so that's what it is. She wants the tangible. Or sometimes we do see the access to tangibles in toddler rooms more often because it's about exhibiting of a behavior to get something, to get a toy or something like that, which is very developmentally appropriate and probably wouldn't require an ABC chart or a behavioral support plan. But most of the ones that I see in terms of like tangibles are to get some type of reward.
And then sensory stimulation. But you can imagine that the reason we see these two much more frequently is because oftentimes teachers aren't using tactics that allow this to be the consequence.
So I put in here just a couple of things in terms of, I focused on attention, the function as attention, and then the function of escape in terms of reactions, because I think we sometimes forget how big of an effect those things can have. So we talked about proximity. If it gets physical closeness to another person, that may feed into or fulfill that function for the child. Praise. Same thing, it can be good, it can be bad, but again, it feeds into that function of behavior. So behavior-specific praise can be a good thing if you're using that as part of your behavior support plan. It can be a bad thing if they're getting some kind of praise from you and it's causing a behavior that you don't want to happen occur. Just talking about the children's behavior in front of them. They can feed off of that. It fulfills that function for them. Oftentimes, what we always say is just more respectful for us. When parents kind of ask about their day, we'll often say, oh, I'm going to give your mom a message about how thoughtful you worked on the sensory table today, and then I'm also going to talk about this. In this case, when their function is attention, talking about that child's behavior is going to fulfill that function for them. And then also your reaction. So like Meredith said, I have a really hard time with harming another child, and I get really worked up. That child is going to feed off of that emotional reaction if you're unable to hold it together. And same with your tone of voice. I can't believe you just bit somebody. Loves it. That child that is attention seeking just had that function fulfilled. And then the presence of others.
I think those reactions, that tone of voice is especially important to communicate to parents about that, because children often know their parents' triggers as well. And so they might do these things that we might never see at school, but they say, she says this at home, or she does this, she runs towards the street, and we never see that. But if they're getting this maximum reaction, And then when you do something, when 95% of the time at home, you're doing what you're supposed to and things like that, but that 5%, you do these things that get these big reactions, that's going to reinforce, maybe I should do more of that if my function is getting attention.
Another big one is big movements. So if you have a particular child who's biting another child or physically harming or even running away, and you bolt across the room, again, that feeds into it. If you're calmly walking over that child and you're going to set down a limit or you're going to do their behavioral support plan, it's going to be much more effective because you running across the room going, oh my God, is definitely going to feed into that function. And then the other big one we see is the escape function. So giving in and not following through with a demand or a directive, or that demand changing or removing the unwanted demand. So a couple of examples that I had wrote down would be like, so your particular child, let's say, has some behaviors around those transition times. So he comes into the classroom, the teacher gives him a directive, go ahead and put your backpack in your cubby, and then the child starts throwing his backpack and swearing at the teacher. So the teacher has given him a directive, that's the antecedent. The behavior is he just called his teacher something special and threw his backpack. And then the teacher is having this happen and doesn't want it to continue happening anymore, so she just goes ahead and picks up the backpack and hangs it in his cubby. What she did just do was give in, and she didn't follow through with that demand. So she said, do this, and then didn't make that child do it. So she fulfilled the function of that behavior. The other one would be around, we see it a lot of times too with directives like washing hands, the steps that it takes you to do in terms of like bathrooming. So first, get soap on your hands, then wash your hands, get paper towels. Simply another one would be a parent saying, go in and wash your hands, and then it's time for lunch. And the child doesn't want to wash their hands, so they throw a tantrum. And then the parent says, well, you don't have to wash your hands before lunch. It's fine. If you're going to throw your body about it, I don't want to have to deal with the tantrum. It's just much easier just to say, here's your lunch. Let's pick our battle. But you gave them a demand, and then you took that demand away. So when determining the function, we gave a couple of examples that were fairly easy, but it's not always that easy. It's not always that obvious. It can be really tricky, and here's why. The same behavior for different children can serve different functions. The same behavior for the same student can serve different functions. So that same child may exhibit multiple behaviors, and it may have different functions, but it also may have the same function. So that's where it gets to be tricky. That child may be running out of the classroom, hitting other children, destroying property, all for attention, or each one of those behaviors may have its own function. So it can be really tricky to sift through all of the data that you're collecting to determine, okay, so when it's this behavior, that's linked to this function. When it's this behavior, it's a completely different function. So it goes back to that early childhood contexts are unique. Each child's unique, and that's why the data is so important.
And I think about how, this surprised me not that long ago, about how the behavior can serve different functions. So in this case, a child was at nap time, which is really a time where you're a little bit more limited as a teacher in terms of your strategies. So the child started screaming, so I went towards the child. The child was not hurt, the function was to get a teacher attention. Got the teacher attention, so that was satisfied, and then kept screaming, and so I took the child out of the classroom. And so then the function was escape. So that child, same behavior, it changed the function because it just served different, like I said, functions for them, and very sophisticated. That's when you think, wow, it's kind of amazing, human nature and how we can interact and how sophisticated we can be in terms of changing our behaviors or manipulating our behaviors to serve the same function or different functions.
Here's a couple other ABC charts that we have implemented downstairs for you to take a look at. So the one I showed you was very open-ended. As we start kind of understanding the functions of their behavior more, we try to simplify it for ourselves because we don't have a lot of time to document. So these are more of like checklists.
So you want to develop a behavior support plan when you really recognize this need, right? So it addresses the function, addresses the consequences. You're being really intentional about these things. Again, it's not distraction of, well, maybe if we just, if he got to play by himself more often, it'd be better. We need to really say, like, what is this function and how are we going to react to it? Again, it teaches a child that they can fulfill the function in an appropriate way. And it also teaches the child to decrease their dependency to have particular function filled. So it's not something that would be ongoing. So Kristen alluded to earlier that you wouldn't use these behavioral supports for years and years. The idea is to use some of these and then slowly take them away. They're supports. You think about if you have a physical injury, you might have some kind of support with you. These are things that you just need for a little bit, but not forever. I'll pass these around. In addition, there are things called social stories. Are people aware of social stories? It's a way to kind of help that child. It's kind of priming them for what could happen so that at that moment when they're experiencing it, when we know that children this age don't have great impulse control, that they already have it in their mind of this is what I could do. Because at that moment, you're not always able to use all of that executive functioning to be able to say this is what I should do, this is the pro-social thing to do.
Do you want me to pass out some of these other ones?
Yeah, that'd be great. Thanks.
So these are just some examples of things that we have done, like choice charts. So these are what my choices are. Here's my kind of rules for play. I need to play carefully with materials. I need to keep my body to myself. And then they get choices. And then if something happens in one of those particular areas, then those choices get moved to where it's not a choice. So these are just kind of choice boards that we've created. And they're very different because they're specific to specific children. So sometimes it's about how they're spending their time. Sometimes it's about different transitions that are happening. Just pass those through. Yes.
And I think what's really powerful about these type of visual supports and tangible cards is that it takes a little bit off of the relationship between the teacher and the child. Obviously, you always want to be building that in a positive way, but if the child comes to see the teacher as the person who's always limiting them from doing something they want or not helping them satisfy the function of their behavior, it kind of takes that off that because it's showing what you can and are expected to do, and they can be a little bit more independent in it as they grow through that. So I think you might know the answer to this. When do you think you teach these important social emotional skills? So if this is your crises, right? This is the tantrum, let's say. When do you think is the most appropriate time to be teaching these kind of skills?
Before and after.
Before and after, right? So before, so this might be even, you could reference this as, yesterday, if it seemed like it made you really, really upset when 3 people had those trucks and you didn't have any to play with. So again, you're kind of priming them for if this happens, let's work together to decide on what some appropriate choices would be. As you're going through these, or I would even say as they're escalating, sometimes that's not time to teach. There we go. Whoops. And then much after. And the thing to really recognize too is, well, you as a teacher might be feeling like we're coming down from this, it's becoming resolved, things like that. That child needs to be down from that kind of heightened emotional state for a long period of time before they're ready to use those coping skills, to use those communication skills, and for it really to be effective.
So I like to think of these eras as the preventative stuff. So the things you're putting in place all the time, you're kind of prepping them. You see some triggers that might trigger a certain behavior happening, so you're already enacting some intentional teaching here. The era at the very end is that ship has sailed. That behavior has happened. We are through it. We're in it to win it now, and it's over, and we've left some time for the child to calm themselves, and now we're going to do some reactive strategies.
And it's important to know that sometimes these behaviors are going to get worse before they get better. The best preventative strategies, the most effective pro-social curriculum is not always going to work with every child, and it's not always going to happen quickly. If you come in with that expectation, you're probably going to be disappointed.
So like I said, with those beginning areas, those are going to be your preventative things. So your intentional teaching. Maybe you're going to say to that particular child, so every time he's around the sensory table, and that usually happens to be where he starts taking toys and hitting other kids, I'm going to remind that child, remember, you can say space, space, space. You know, we're constantly doing some intentional word teaching there, for example. You're going to add things here to decrease the likelihood of the behavior even occurring. So this is all the stuff we've been talking about earlier today and all day yesterday. So adding things to decrease that behavior. We're trying to prevent the behavior from happening. Once the behavior has happened, then we're manipulating things, and we're trying to avoid reinforcing that behavior. So we're trying to not fulfill that function for them. So we're coming up with different ways for them to fulfill that function in a more appropriate way. So these are going to be your function-based interventions.
So looking at strategies on the whole in terms of the different types of functions, there are many things you can do, a lot we've addressed. So if it's attention, behavior-specific praise, so not just saying, hey, good job over there, being specific. I like the way that you saw that your friend really liked to play with those trucks. You shared it, that makes me so happy. Or even more effective can be, look how happy that made your friend, and look how happy you are. So they're not depending on you for the emotional reaction. Like Kristen said, no sudden movements. That can be really gratifying if you get those huge emotional reactions, those huge bursts of teacher physical reaction. Switching teachers, Jen alluded to this earlier. Switching teachers has become really effective in our classroom. And even throughout different classrooms. Again, it takes it off of that power struggle, and sometimes it's just the novelty of working with a different type of teacher. Sometimes it's just not, I didn't really want Kristen's attention. I wanted Emily's attention, but Emily left and Kristen came in, and now it's not that big of a deal. That power struggle's over. The if-then card, so if I do this, if this happens, then this.
The good example, I think, of that, I don't know if it's floating around, but this was kind of a similar idea of an if-then. So nap time was particularly hard for this child, and so the behavioral supports came in, and she kind of knew her rules. Like during that time, she wanted to fulfill that behavior, attention-seeking behavior. And so her rules were no hitting, no screaming, no running. And if those things happen, if they don't happen, you followed your rules, then you can work on the iPad. You can do an app on the iPad at nap time or after rest time if you're not napping.
Which speaks highly to the individualization. It would be inappropriate for us to say anybody who stays on their cot during nap time gets iPad time. That's not what that's about. That's not building that intrinsic motivation, but we need to meet the child where they're at. And so this extrinsic motivation helped as a support, and then we can take lessen that a little bit as they grow with more of that intrinsic motivation. If escape and avoidance is the function, break cards. So what that means is this child, it might just be too much that for a child to be in a classroom for this long of a period of time. That example I gave earlier about if I, as an adult, am frustrated and I can say, I need a 5-minute just breather. I need to go take a walk around and I'll feel better when I come back. Children don't have that opportunity when they're in a classroom. So a break card can be something where they say, I need a break. And that's a really great, when you get to that moment with a child, when you've implemented that behavioral support, it's so great when they've done that because they've recognized in themselves that maybe I'm not going to be able to function very well. I'm feeling overwhelmed. I'm feeling maybe there's too much sensory stimulation in the classroom. I need a break. Lavishing with praise, that's just a great preventative strategy as well. So that child's not looking again for that attention, no matter if it's negative or positive later. They're getting it early on. And sometimes that doesn't always, for me, that doesn't always feel that comfortable because I really love that intrinsic motivation that they want to do that because that's the right thing to do and that's what's pro-social. But I have to realize sometimes children just need something different and they need more. Sensory stimulation, some ideas for this. Say a child is throwing things in the classroom but doesn't seem to be because of any other reason, like they're not trying to hurt somebody, or to say they're jumping on the couch a lot, and it's not about getting attention, it's something they really need. Some heavy work ideas can be really grounding for some children. So what that could mean is like picking up heavy blocks or pushing heavy carts, things like that. So they're not looking for it elsewhere.
And sometimes we have seen the sensory stimulation when it does come to like hitting and biting and things like that, they just don't have control of their bodies, and it feels good to make contact with another person. And what we would see in the documentation, though, that even though it felt like it was just constant hitting and kind of aggressive behaviors towards other children, it was the same for other things in the classroom. So they would intentionally kind of run their bodies into a shelf, you know, something that you would think would really hurt. It actually fulfilled that sensory need for them. So some children are sensory seekers, and then some children are overstimulated easy.
Right, so that's when you want to monitor that environment. Do you have lots of fluorescent lights on, lots of overhead lights? Are there spaces where it's quieter in your classroom, or are there spaces where they can be alone? That's another thing, again, when I compare that to adults. Does this child have any space in this entire room for 8 hours a day that actually really is theirs? And so they can actually, then they can be proactive and say, I'm overstimulated by what's going on here. I'm going to come sit down in this space that's mine. Tangibles, one I think is really effective in preschool is visual timers. Again, it takes it off the relationship of the teacher. So instead of me saying you can play in 5 minutes, this timer is what's going to tell you. So it takes away from that power struggle.
Another one we find pretty effective is like I think the preschoolers use it more of sign-up sheets where they write like whose turn it is. We do visuals with their pictures, and so they can see, oh, I'm the third one, so I just have to wait until these people are done. And so we just kind of move their pictures. Whose turn is it to turn off the light? Whose turn is it to jump? You know, those kind of things. So they're more like turn-taking signs for us.
Right, and then that sign-up sheet says, rather than the adult just saying, you have to wait your turn, you have to wait your turn. 5 minutes can seem like an eternity when that is your favorite thing that you want to do, and then that might lead into other behavioral issues that you have because that child doesn't feel validated, doesn't feel respected that they're going to have a turn. If you can visually see either a picture or you know that you wrote down your name and that you're third person on the list to do that, it's much more gratifying.
The other one I put on here was like a 5-minute card. We've had some children who are, you know, exhibiting those behaviors because of the access to tangibles, but also have a language delay, and so they can't use their words to say I want that in 5 minutes. And so we make some type of card that kind of indicates 5 or a hand up with a 5, and they can just hold it up. When it gets to that point, their behavior starts to get revved up. So these are just a couple of examples of what's floating around. So rules for my break. So if they want a break, this is a way to fulfill that function of escape or avoidance. So you're giving them a way to fulfill that in an appropriate way. So you need your break, you're holding out your break card. Here's your choices. You can use a quiet box idea, you can take deep breaths, you can do quiet exercises. Here's where you can sit, you can use a quiet voice.
Again, this is satisfying what they're communicating to you in their own way that they need. So you're not just distracting and saying this is something else you should do. It really addresses what they need. Again, when I feel mad, and sometimes you can even take pictures of children and acting it out. You wouldn't necessarily want to take a picture of a child when they're in a big tantrum or anything like that, but you know, it's a great way proactively to say, you know, I've noticed that you're getting mad a lot. When you get mad, what do you think you can do? And then even having their pictures there can be really powerful.
And something Meredith and them have done some studies just of emotions, and they let the kids take pictures of each other, making different facial expressions, and I think that's a great way to be able to make these kind of cards and make them authentic. I mean, this is fine, but I think it's much more authentic and meaningful to children when it's either themselves or children that they know and have a relationship with, rather than clip art.
Right, and that we know that developmentally perspective taking is already a major challenge at this age. So just having a visual to be able to say, and also if you as a teacher act out those things too, like I'm mad, and you stomp like them somewhere, they think it's absolutely ridiculous and hilarious, but it's because they're not able to see that, oh, that's exactly what I did 5 minutes ago. What they can see is that is not the way that you act. They're quick to point out what you shouldn't do, not always able to take on that perspective, but with some explicit instruction, it can come around.
So we kind of broke challenging behaviors down into some of our hot topics that we thought of. And so the big one for me, Meredith is going to kind of take charge of a lot of the preschool behaviors because, as we know, a lot of the infant toddler kind of behaviors are developmentally appropriate. And biting is developmentally appropriate, depending on the age that you work with. So for 18 months, yes, but we really would expect like tantrums and biting and some of those aggressive behaviors to decline as a child approaches the age of 3. But biting is a big one for in the world of toddlerhood. So some preventative things that you can do, obviously, multiple toys, private intimate spaces. So space is a huge thing when it comes to biting. Children bite to get space. So having some spaces where children can kind of squeeze into a little space or be with just another pair and not in a large group setting all the time. Looking at those things that can be overstimulating for children. Limiting the number of transitions when you are transitioning. Is there something for children to do during the transition or while they're waiting for several minutes? Providing sensory or oral motor stimulation for them. Sometimes it is about teething or they are still in that kind of oral stage or just very oral sensory related. Being really intentional with your teaching and then amping up your teaching to minimize attention on the aggressor. So we want to focus less on the child who bit and more on the other things that are going around, because if that function is attention and we're giving him or her a lot of attention for biting, then we're fulfilling that function. As far as reactive kind of strategies, I think you need to be quick, you need to be direct, you need to be really firm, you need to say stop. You can have the child who was bit say stop or sign stop. Explaining that the behavior is not okay is important. I think it's really important to refer to the child who was bitten, really make the connection between what the behavior was and who that behavior happened to. A lot of times we get into it's not okay to hit your friends. It's not okay to bite your friends. I think it's important to be really specific about what friend just got bit so they can make the connection between the consequence of their behavior and their behavior. Shadowing is always really effective for us, being in close proximity. And then the other thing that we do a lot is to have them have an appropriate thing to bite. So a lot of times what we do is those little things that hook pacifiers on them, we just hook teethers on them. And so we do that, and then it's with them all the time, and then we can constantly redirect them to something appropriate.
A few of you have talked about physical and verbal aggression. So we've talked a lot about the preventative. One thing to really point out is creating a safe environment. So if you know you have a child who their big emotional physical reaction is throwing things across the classroom, you're going to want to make sure you avoid. We have many glass jars in our classroom, just because we want children to be able to have the opportunity to use all different types of materials. But if I'm in a situation where I know a child is becoming physically aggressive, I'm going to probably remove those before that even before the day starts, or I'm going to physically make sure I'm blocking some materials that are not safe. Also, maybe having a place, if you know a child is punching a lot, having some pillows that they can punch, again, satisfying what they're showing you they need. Reactive strategies, I think, are really important to talk about. Switching teachers, we talked about. In terms of teachers, too, especially when these verbal and physical aggressions are very severe, is that other teachers in the classroom have a major job of amping it up so that the child who is the aggressor is not getting a lot of the attention from the other children, because even the best teacher who's very good at planned ignoring, they might be able to ignore that because they know another teacher is handling the situation. But a 3, 4, or 5-year-old is certainly going to look at a child who is being physically out of control. So that's really important for the other teachers to be extra engaging at that moment. If you were doing some kind of paperwork or something like that, right, you might want to do an impromptu circle time. It kind of takes away from the attention of the other child. Also, in terms of that, we said remove materials, but removing other children from the classroom can be more effective than moving the child who is showing that physical aggression. None of us want to be in so physical with a child. We don't want to be so close to a child when they're being very physical. We don't want them to be harmed. We don't want to be harmed, and we certainly don't want the other children to be harmed. So rather than trying to move the child who's physically out of control to a different space, one thing that I found effective is, again, amping up, like, hey, everybody, we get to do a special idea out here in the hallway. You might not know at that moment what that special idea is, but once you get out there, you might be able to do something like sing songs, something like that, so that that environment and the other children are safe.
And I think you touch on two things there. One, the safety piece, and then if the function of behavior is escaping and you're taking that child out of the classroom, sometimes you're fulfilling that. So instead of fulfilling that by giving into it, basically by removing him or her from the classroom, you're removing everybody else. So that child didn't get what they wanted.
And as you might suspect, this is not a time for a teachable moment. You think about that diagram that we had. You might not even need to say that many things to that child at that moment because they are in such a heightened emotional state and physical state at times that they're not able to hear you, or they're not able to process what you're saying. The most important role for you as a teacher is to restore safety for that child, for yourself, for the other children. Yes.
So I'm just wondering how you word that with the child who is the perpetrator and the remaining children in the class. Like, as I take the other kids out, what would I be saying? You know, so you wouldn't want to be like saying something in a punitive way and making
Sure.
the child feel like they did something.
Right. So it depends on the child and again the context, but I think sometimes even just saying, I'm here to help you. I'm here to keep you safe. Because
Like wanting to go to and feeling like they're being punished by being helped.
right, so that would be a time to say your body, like just really pointing out the exact things that you're seeing. Your body, you're throwing your arms, you're screaming, you're spitting. We can't go out to that space because that's not safe. It's a situation you don't want to be in very often. And then if that is happening frequently, that's really a time to talk to your administrators, think about referrals, things like that, because your number one job is to maintain safety. Also, something to really think about, it's really easy to give that child, the aggressor, all the attention, but another child might have got hurt in all of that. And so again, with other teachers really amping that up to come over and say, oh, Sarah, I see that you got so hurt. Just because sometimes it can be such an aggressive situation where everybody is talking to Maria about, how she was so out of control, but nobody even went to talk to Sarah. So what does Sarah learn? That doing that and other children learn doing that gets everybody's attention. But just really making sure that everybody's being taken care of. And then with verbal aggression, I find that's really difficult. Like we touched on earlier, just try to have a minimal reaction to it. Oftentimes, children just know that it gets a reaction. They don't necessarily know the meaning. Now, some children do use it in context, but usually that's much less aggressive towards you. Right, exactly. So just trying to minimize your reactions to that. They've obviously learned it. If they're looking for attention from that, they've learned that somewhere. Maybe an older sibling too, like, watch this. If we teach little Johnny to say this, it's hilarious. And so then they get that. So a verbal aggression towards like saying just really mean things towards other children, sometimes that's a time to just kind of remove them, or that can be a time where I find distraction helpful, and then addressing that later, so that you're not even giving that much attention to it. But you're like, oh, look at these magnet tiles. I'm going to start playing with these, and then addressing that later. Running, escaping, we talked again about a lot of the preventative strategies. Lavishing with praise, I would highly recommend, even more so than you usually do. In terms of reactive, if you start running across the classroom or you yell across the classroom, what that has taught that child is, if I do this, then this happens. Again, minimizing reaction. Alert other staff calmly. So to say, hey, Allison is running down the hall, creates alarm everywhere. If you know this is happening frequently, you can walk out of the classroom, alert other staff to say, and sometimes I've even had the strategy of getting the phone. I'm walking towards that child, but I'm calling another classroom or calling an administrator so they can calmly walk out of their office or their classroom and calmly address the situation. So they're not getting that reaction that they wanted.
The chimes on the door, I thought that was a good idea too. So if you have, you're closing your door already as a preventative measure for happening, but then putting an additional support by adding a chime to the door. So as soon as that child hits the door, opens that, something's ringing, and you're on it.
What if they like the ringing? So
Well, then
they
I
open the
think,
doors as many
then,
times as
then I think it's not, it's not going to be effective for you. I think it's more for like an alert to teachers. If you're all engaged on different ideas and that child sees that and then makes a run for it, safety, restoring safety is the most important thing. So if that's going to give you an extra precaution to a child running out of the classroom and down the hall where you don't have access to them, then I think it's a good idea.
And I've definitely seen like alarms, that it does like some kind of beeping or something like that. I got these little wind chimes at the Dollar Tree or something someplace like that just make a soft noise. So would it be? It's not super alarming, but after 9 years of hearing that, if I hear that, and it's sometimes even a teacher will walk out the door, I'm like, oh, that was just a teacher. But it's like a Pavlovian reaction now that I hear that, and I'm like, something has happened. Go ahead.
No, I think you're right.
As we all know, we can't do this alone, and the family teacher partnership or family school partnership is so important. It's really important to have ongoing communication with parents. Now, that's not to say if this is something that is a recurring issue, you want to address that, but you don't want that parent every single time they come to pick up their child to just get this negative report. That's really disheartening. I also couldn't imagine as a parent just that dreading of, I'm going to come and they're going to tell me all of these things that my child did wrong all day. So really looking for those positive things, even if there was a lot more negative things that happened than positive, addressing the issue, telling them how you're working on it, asking them if they've seen it at home and how they address it. Once you have that open communication and honest communication, it can be wonderful because you might realize at home they're doing this, so it's no wonder they're doing that. If they're tangible is, if I say you get a cookie and then they stop doing what they're doing, or I get them to stop having a tantrum, well, no wonder at school when I'm trying to get them to stop tantruming, it's really difficult because this is what's going on at home, and then you can have that open communication too. Again, then also deciding whether referral is necessary. The more open and honest you are with parents, I find the much more receptive they are when it comes down to, I've taken all this data. This is not just me saying, your child's not listening, so we have to get something taken care of. You can hold up this chart, you can say, these are the things that we've seen. We already had a conversation about what you see at home. Here's how we're seeing it, and we're seeing this pattern develop. We've had this, and this. You've taken these steps before you are saying referral, because for some parents that can come off as really scary or a really negative thing to say that your child needs extra supports. Other parents say, thank you, I need some help at home too. But just know that every parent and family is unique just as every child is.
And I think being an advocate and like walking them through that referral process, I know from an infant toddler perspective, you can't refer children based on behavior. So if you're going through like Help Me Grow or something like that, oftentimes they'll find, there's something in connection with that. So it might be a language delay. It may be like an OT, PT thing with like sensory seeking behaviors. And then you can get some additional supports, like, like sometimes they'll write in a weighted vest or some heavy work ideas or something like that into an IFSP. But other than that, in terms of infants and toddlers, there really isn't a referral other than Help Me Grow is who we refer out through. And then once you get into the preschool age, you can refer more based on those kind of behavior problems.
And I've definitely had many situations where you refer and they don't qualify for services. So it's really important to, just because you've done all of those steps, they might still not qualify, but be an advocate. There are a lot of rights that these children have and these families have, but you as the professional and the educator are there to be that advocate and say, if you don't agree with this, you can say, I don't agree with what the school system, their decision was. I think overall, in terms of this, your style of communication can make the difference, such a difference in the way that you're partners with families. I think it's really easy, especially when you're bringing up these things that are of concern or aren't pleasant to talk about, where teachers and parents can almost see as they're butting heads or, gosh, they're always telling me what my child's doing wrong, and I just don't think that's it. I don't think they give them enough choices, things at school. If you're coming in it together as a partnership and saying, I want to help, again, same as like with the children, you don't just come in and make assumptions and just try to fix things, but if we're working together and say, how can I help and how can we help each other? Go ahead, Kate.
Oh, yeah, I was just going to say that for us, one thing that was helpful was kind of like reframing the behaviors we were, because like things were happening in our classroom that and it would be inappropriate not to address them, but we found the child would, be hitting and throwing things, but then afterwards be, I want mommy, I'm sad, I want to go home, things like that. And so sort of focusing in on that when we would talk to mom, being like, oh yeah, he was very sad and talked a lot about wanting to go home. That way when she talked to him about it, it wasn't like, why did you think it was okay to be throwing stuff? And why, it was more like, why were you feeling sad? And why were you feeling like you didn't want to be at school? And I think that just helped to like reframe the conversation they were having.
Thanks for sharing that.
So the last thing, we just included some resource and referrals for you that you can look into. Certainly you can use your local school district. That's who we partner with a lot. We partner with Ohio Help Me Grow for our infants and toddlers. Their Early Head Start has mental health consultants. We've used St. Vincent's. There's lots of psychological services. I know that Meredith has partnered with Nationwide Children's Hospital Behavioral Health Services before. I think that might be even where that functional assessment tool we may have gotten that from them, but they've come out and done observations for us before. So we've made some great partners with mental health consultants from Nationwide Children's Hospital, Franklin County Board of DD, and basically how we've obtained a lot of this knowledge on FBAs and ABC charts and things like that is we had a year-long partnership with Nisonger Behavioral Support Services, and they came in and did coaching with us, and we studied with them as part of our professional development, and got lots of PD in terms of like PD sessions like this, but then one-on-one help with their behavioral support coaches as well. So those were just really helpful resources for us, and those should be included in your packet. Does anybody have any questions for us? Yes, ma'am.
So one issue that I run into a lot is the running away, and one thing I've noticed is that it sometimes comes after the child fails at initiating play, and they don't know how to initiate play. They're not so much of a hitter to initiate the play, but they'll say something to the other child, and the child will reject them, and so they get rejected constantly, and so then they run away. How would you address that with the child? What would be your preventative measures?
So yesterday we talked about appropriate ways to initiate play and how children think that asking to play is a good way, and that is just setting yourself up for rejection because you're giving children the power to say yes or no. So I think teaching that particular child skills at parallel play and how to, remember I talked about just easing into a play situation rather than being a force to be reckoned with when you come into a play situation, adding something to the play. But then I also think as your peers that are around, you need to teach them some skills about having positive relationships with the other children in the classroom and how to be a good friend, how to include other children. I think those are both good preventative skills that you can teach.
Also, like modeling and really explicit instruction. Oh, I see they're playing with farm animals. I want to play with farm animals. The teacher kind of saying, if I want to play with farm animals, I better get one that nobody's using, and then I can say moo and see how they react. So really being kind of over the top in terms of this is how you do it, because that child isn't picking up on those social skills, so they're not probably falling into that tier 1 where they're kind of getting it naturally.
So we went over yesterday the upcoming events, all the ways you can connect with us, Google Scholar, Twitter, our website, earlychildhood.ehe.osu.edu. Our upcoming events, I highly recommend the symposium if you can make it in October. I think it's October 7th. That's a free symposium. It's about the effectiveness of universal pre-K, if you're interested. There's some family brown bag workshops in there, more practitioner workshops as well as research workshops. So I hope you guys enjoyed the PD workshop for today. If you don't mind filling out the survey, and I'll stand back at the door, collect your surveys, and give you your in-service form.
Thank you all.